Hello guys, my name is Dr. Afif Ali. Today I will be discussing about the acute management of acute coronary syndrome. What is this acute coronary syndrome? Acute coronary syndrome is anything related to the coronary arteries. Coronary arteries are those arteries that are present in the heart, and anything which happens to those arteries can damage the heart muscles, and because of which it can be called as acute coronary syndrome. So today we will be discussing about the management of acute coronary syndrome, and it will be without ST elevation. So there can be two types of acute coronary syndrome. One can be with ST elevation and one can be without ST elevation. So if there is with the ST elevation acute coronary syndrome, then it is most probably a case of commonly known as heart attack. And if it is without ST elevation, it can be, if troponin T is elevated, then it is a case of heart attack, and if troponin T is not elevated, then it can be case of an angina, unstable angina. So what are the risk factors for a person to get into angina and then into a heart attack? What are the risk factors? So first of all, the risk factor is high blood pressure. Anyone having high blood pressure more than 140 systolic upon 80 diastolic can be case of angina, can be case of acute coronary syndrome. And further, if there is a smoking history, if the person smokes, and then it can damage the vessels of the heart, and it can cause further a case of angina. And uncontrolled diabetes, if a person have uncontrolled diabetes, then it can cause angina. Then overweight or obese person, obesity can itself is a risk factor for acute coronary syndrome. And then metabolic syndrome, as well as inactivity, loss of daily activities, morning walking, brisk walk morning. If the person sits more throughout the day, like today's lifestyle, so it can lead to further acute coronary syndrome and angina. And if the cholesterol levels are high, if the cholesterol is very high in uncontrolled level, more than 200 milligram per deciliter of cholesterol level, can give rise to the atheroembolus. Embolus is any atherosclerotic plaque is anything which can block the coronary vessels as well as other vessels of our body. And family history of heart attack is also a risk factor for angina. So anyone having a family history of angina or heart attack should be very keen on regularly checking up his blood pressure as well as sugar level, as well as should control the cholesterol levels of their blood. And so this picture demonstrates about the what happens when there is acute coronary syndrome. There is These are coronary arteries, and coronary arteries is are the we know that the artery which supplies the heart are coronary arteries. So plaque binds up in the artery. This is the plaque which binds up in the artery. Then further, if this cholesterol atheroembolic plaque, if this plaque further narrows the lumen of the arteries, then it can decrease the supply of the blood, and thus decrease the oxygen supply to the heart muscles heart muscles which are supplied by these arteries. So blocking the supply will lead to further it can cause decrease in the oxygen supply, and it can cause a case of angina, which is a chest pain, which is severe chest pain on the front of the chest, or and it increases with exertion, like when we are walking or when we are climbing stairs, then it can cause a case of angina. Now this is angina. What is angina? Angina is a chest pain which occurs because of the narrowing of the coronary arteries, and it can happen anywhere between this jawbone to the umbilicus. It can arise from the center part of the chest where the heart lies, and it can go from here chest to the mostly to the left arm. It can go to the left arm, and it can go to the back also. It can go to the back portion of the body, and it can go to the right arm also. So if there is a chest pain on walking, on climbing stairs, or on walking, then we should evaluate it further. So this is the artery which is getting blocked, and because of the which the supply to the heart muscles is decreasing, and which can cause angina. So there can be further on investigation. We should have an ECG done, and on ECG, if there is ST segment elevation, or if there is any T inversion, then we should be very worried about what is happening inside. So in case of ST segment, or in case of ECG, what can happen is either can be it can be ST segment elevation, or it can be ST segment depression also, and a T wave inversion also. So what is ST segment elevation? We see this waves. This is the Q wave, Q, R, and S wave, and this is the T wave. So this is the ST segment, S and T segment. This is the ST segment, and it is elevated from the baseline. We see this is the baseline, and this is the ST segment elevated. This is elevated. So it is ST segment elevated. It can be of many natures, like it can be ST segment elevation which is convex upward. It is convex upward. Then it can be a straight upsloping. It can be a straight upsloping ST segment elevation. It can be a straight horizontal ST segment elevation, and it can be a straight downsloping also ST segment elevation. So we see elevation from this baseline. It is elevated. This is elevation. This is the baseline. This is the elevation. So anything ST segment elevation which is convex, or it can be straight. Convex or straight is mostly is because of myocardial ischemia. It suggests myocardial ischemia. And if it is concave upward, it is common in all population, and it is ST segment. It is non-ischemic ST segment elevation. It is not because of ischemia. But still, if there is chest discomfort, we should further evaluate the case. Then the example of ST segment elevation caused by ischemia. These are the examples where different patient with ST segment elevation is there. It can be of different shapes, like this one. This is the baseline. This is the ST segment. This is elevated, like this is convex upward. Then this is straight ST segment elevation. It is elevated, and it is straight. And then this one is this is elevated also, and it is a straight upward. Then this one is it is a straight upward, and this one is this is slightly elevated ST segment elevation. So whenever it is when it is more than one block, more than one small block of ECG, and then it is known as ST segment elevation. Mm, okay, and this is the limb lead showing ST segment depression.